Good afternoon, everybody, and thanks so much for joining us for this Baker Institute for Public Policy webinar on global humanitarian aid and the coronavirus pandemic. My name is Kelsey Norman, and I'm a fellow at the Center for the Middle East at the Baker Institute, and also director of the program on women's rights, human rights, and refugees. So first, we're going to hear from Marcia Baek, who is a freelance journalist focusing on international conflict and humanitarian crises. She contributes regularly to the PBS NewsHour, for whom she recently reported from Venezuela as its refugee crisis becomes one of the world's most dire. She also has over a decade of experience working in the Middle East, and in 2018, she became one of the few television journalists to travel to Yemen, producing a 4-part series for PBS. So maybe she'll also speak to that ongoing humanitarian situation during the Q&A. Her work has won numerous awards, including a Gracie Allen Award, 2 first-place National Headliner Awards, a Sigma Delta Chi Award, and a New York Festival's World Medal. The Newswomen's Club of New York awarded her the 2018 Marie Colvin Front Page Award for Foreign Correspondence, and she was recently nominated for a George Foster Peabody Award for her work in Yemen. After Marcia, we'll hear from Devin Cohn, who is a senior advocate for women and girls at Refugees International. Her most recent research focuses on asylum seekers camps on the Greek Aegean Islands, and in her position, she's also conducted research on displacement in South Sudan, Mozambique, and Zimbabwe. Before joining Refugees International, Devin served as the director of protection programs at HIAS, where she was responsible for providing technical expertise to HIAS's protection-related programming globally, including setting up a free legal aid office for asylum seekers on the Greek island of Lesbos. She has also worked for the United Nations High Commissioner for Refugees, the UNHCR, in Lebanon, Uganda, Egypt, and Kenya, and for a variety of NGOs providing services to refugees. And then last, we'll hear from Chase Sova, who is Senior Director of Public Policy and Research at the World Food Program, USA. He's also a non-resident senior associate at the Center for Strategic and International Studies, Global Food Security Project. Previously, Chase worked with the United Nations Food and Agricultural Organization, the International Center for Tropical Agriculture, and has also consulted with the World Bank, Johns Hopkins University, and Tufts University. He's interested in the intersection of food insecurity and conflict, humanitarian assistance, climate change, and sustainable agriculture. And he's worked on food systems in 15 developing countries across Latin America, Sub-Saharan Africa, and South Asia. So I'm so excited to have this this lineup of panelists to talk to you about this increasingly important topic, as the world faces not just the direct impact of the coronavirus itself, but also factors like the unprecedented closure of borders and secondary economic and social impacts for pre-existing humanitarian crises around the world. So each panelist will speak for about 10 minutes, and then we'll have about 25 to 30 minutes for a discussion and Q&A. And you're welcome and encouraged to submit your questions throughout the webinar by using the Q&A function at the bottom of your screens. Okay, so let's begin with Marcia.
Hi, thank you so much for having me. I'm really honored. We don't have a ton of time. We have a lot to get to today, so I will just go ahead and start. In January, I spent about a month in Venezuela for PBS NewsHour, covering various facets of the humanitarian and political crisis there. What I found was a massive gasoline shortage, where people would wait in queues for 24 hours at a time to fill up their tank. This has only become worse. Caracas, which had been kind of in a bubble and protected from that, is now experiencing that as a new normal. I found a food crisis. Price and import controls had been lifted, but with hyperinflation, no one can afford to eat. You're talking about a place where minimum wage is around $5 a month. We would go to a restaurant, and when we would come outside, there would be hordes of people that would be waiting and rushing towards us to get first dibs at whatever leftovers we would bring outside. Inflation was bad then. It was about 50 to 80,000 Venezuelan bolivars for the dollar. Now it's more like 182,000. So before COVID, people in Venezuela really were relying on remittances from outside. This was the largest refugee or migrant crisis outside of a war zone, the largest in the world outside of a war zone. 5 million people had fled. 5,000 people a day were leaving. Now what we're seeing is the fears of a refugee crisis in reverse, with people being evicted from their homes in bordering host nations or losing their jobs because of national lockdowns and quarantines. So it's really the perfect storm of sanctions and an already existing humanitarian crisis being made 100 times worse by the domino effect of COVID, falling oil prices, people returning home, and all of this amidst a healthcare system that cannot protect them. I'm going to show you a shortened version of a piece that we filmed for NewsHour, where we went undercover in a couple of hospitals in Maracaibo and a couple of hospitals in Caracas, public hospitals, where rolling blackouts and a gasoline shortage mean there's no electricity in many of these hospitals. There's no soap and no running water. So imagine trying to keep clean. There was no maintenance of crucial mechanized devices, from elevators to scanners. We heard the story of one woman, a dialysis patient, who had gone up to the 9th floor to get her treatment, and the elevator malfunctioned, plunged to the ground floor, and she was cut in half. And this apparently, it never was fixed. The elevator was never fixed. All of this, you're also seeing very few doctors, nurses, lab technicians. One doctor we spoke with said that of her graduating class in medical school of 800, only around 80 remained. And again, 5 million people leaving, of course, you're going to be losing doctors, nurses, and lab technicians. So there are very few left to help the most vulnerable who are left behind. So I'm going to ask them to roll this clip. It's a bit of what I saw in these hospitals.
This photograph was taken just 5 years ago. Happier and healthier times.
Do you remember this day?
But now, Jose Rodriguez is dying. 2 years ago, he was misdiagnosed with tuberculosis, and only 6 months ago, he found out he was actually suffering from a different lung infection. His daughter, Paula Canchila, is a nurse, but stopped working to take care of her father.
That's why I feel so angry, because I've tried to help him, but it's impossible. I don't have the supplies.
A shortage of drugs, doctors and nurses, and even clean water has led to an epidemic of illnesses, a lack of treatment, a complete breakdown. And families like Jose's no longer trust the system.
That patient you're describing, he's one of thousands. We as doctors have observed this before they went to the hospitals. Now they prefer to die at home.
Dr. Dora Colmenares is a general surgeon in Maracaibo, the second largest city in Venezuela. She took us undercover into a public hospital to show us just how bad it's gotten. This is the emergency room, overcrowded with people, only open during the day, and lacking proper supplies or even air conditioning. Often patients are forced to navigate up and down staircases, sometimes climbing as high as 9 floors, with no functioning elevators. We found empty shelves, broken equipment, the ceiling was caving in, and a pharmacy with almost no medicine. Entire sections are locked and abandoned, the remains of a functioning healthcare center. In the country's capital, Caracas, again undercover, we visited an oncology center with Dr. Gabriel Romero. There was only one functioning X-ray machine and one ultrasound for the entire hospital. There was no running water.
No soap, no water to keep things clean. That's why it smells so bad in here.
In this room, women receive chemotherapy. But for a treatment that requires a consistent drug regimen, there is not a consistent supply of drugs. My brother had to bring chemotherapy medicine from Houston because we don't have it here, says this woman who has lung cancer. All these women brought their own supplies, rubber gloves, intravenous tubing, even hospital gowns. 13-year-old Janire loves Minnie Mouse, rabbits, and the color pink. But right now she can barely speak. A few months ago, she developed a lump in her eye. Her mom took her to the hospital in Maracaibo, but because there were no specialists on call, she was told to wait and see.
And all they said was, let's wait, let's wait. But while waiting, it kept growing in her eye until they realized it wasn't what they thought and instead was an aggressive tumor, something like cancer.
While they're grateful that she's finally getting treated here in Caracas, it's too late. She will lose her eye.
How do you feel knowing that this could have been prevented?
It's hard to see her like this, to see her suffer and cry in so much pain. That's truly not easy. It's an experience that I really hope no one else has to live through.
Back in Maracaibo at the Rodriguez home, the family is desperate for help. Jose has trouble swallowing food and is wasting away. A week later, we learned that Mr. Rodriguez died. Dr. Colmenares says he's just one of thousands who are too sick, too poor, or too afraid to come to the hospital for treatment. And so he won't be counted in official statistics.
Our hospitals have become extermination camps. The people that go to them know they're going to die there.
I mean, what you're describing to me sounds like things I've only seen in war zones.
And this is war. We are at war. But this is something unseen. You don't see grenades. But they're killing us. They're killing our future. They're killing our children.
That's still so difficult for me to watch that. I was there and I've seen it probably a million times, but this is the context through which you need to view this pandemic in Venezuela, and through which you need to view claims about case numbers, about treatment, about testing. The official numbers, I think, are something around 540 confirmed cases and 10 dead. And there are claims that there are 25,000 people a day are being tested. But at the same time, all of those tests are being funneled through one specific lab in Caracas. So, and with a gasoline shortage, how are all these tests reaching that lab within the 2 or 3 days that are needed? This lab is reportedly backlogged with thousands of tests. And having seen how overwhelmed the most basic services are, I can believe that these numbers are not accurate or not really representative of how this virus is playing out or is going to play out. But then again, this is not a place where transparency is valued, and I could talk more about this a bit later. It's being claimed that the border crisis, the people returning home, is sort of the biggest threat. 4,000 people have tried to cross over in the last 2 months. Those who are returning from border areas or who are returning from outside countries via these border areas in Colombia and Brazil, they're being held for 14 days in quarantine. Now, there's very little information about this, but what we are hearing is that these quarantines are being held in abandoned schools, in squalid conditions where there's very little food and supplies. And again, there's very little information because international aid organizations do not have access. But there have also been reports of these people being stigmatized as traitors of the state for having left in the first place. So there are concerns about their safety there. The Venezuelan government started a national lockdown on March 17th, which continues to today. And that, combined with recent lessening in international travel because of the humanitarian and political crisis, was thought to keep the virus at bay. But I think that we need to look at a case study like Yemen, where I've also done some reporting. It was also cut off and seemingly safer from the virus, but also vulnerable, like Venezuela, massive food insecurity, crumbling health sector. And now cases from a single source are multiplying there at a rapid rate. So the lesson here is that when you introduce a virus, even in a small way, to a society that is vulnerable, it can have massive impact. And we're seeing that in Venezuela, and I think we will be seeing that in the broader region.
Okay, thanks so much, Marcia. So now we're going to turn to Devin Cohn, who's going to talk about another sort of pre-existing humanitarian situation and how we can think about it might be impacted by the pandemic. So ready when you are, Devin.
Thanks, Kelsey. Give me 1 second. There's a problem. Hold on. Okay, I'm back. So I want to talk about Greece. Greece is a situation that is obviously in a different hemisphere, which has similar problems in terms of the conditions and the lack of healthcare for asylum seekers in particular. So I've spent a lot of time in Greece in the last few years. As Kelsey mentioned, as part of my previous job, I helped set up a free legal aid clinic for asylum seekers. And then since then have been doing research with Refugees International, the current position I'm in, on the conditions for asylum seekers, and particularly the safety risks for women and children, and particularly unaccompanied minors. So Macy, if you can start the slides. I wanted to, instead of just talking, have you see some of what it looks like there, and give me 1 second, I just need to change my screen. So thank you. So this is one of the images that I took, one of the photos I took when I was in the Greek asylum seeker camp of Lesbos. So the Greek islands, there's 5 islands that host the majority of asylum seekers, and they're hosted in places called reception and identification centers. And these centers are particularly problematic because they have very little access to healthcare, people that are there. They have very little water. They have limited access to food and accommodation. And so again, this is a situation in which there's a high risk for COVID-19 to both take hold and spread because the situation is so dire and the conditions are so problematic. So these conditions have been an issue for a long time. Just to give a little background of what's been happening in Greece is that we saw from the news and a lot of information that came out in 2015, 2016, that there were massive numbers of asylum seekers that arrived. But what they did is they transited through Greece onto Northern European countries. So that was in 2015 when over 850,000 asylum seekers that passed through Turkey arrived on the Greek islands, but they transited. They transited through other European countries and went to Northern European countries like Germany. But then what we saw, because of that, the EU and Turkey signed a deal in early 2016, in which Turkey agreed to restrict the access of asylum seekers to the EU and to Europe. And so the numbers drastically reduced in 2016, 17, and 18. So many, basically 30,000 in 2017, about 30,000 asylum seekers arrived. In 2018, similarly, about 32,000 asylum seekers arrived. But the difference between 2015 and these years where the numbers were much less is that Greece also changed its policies. So they changed its policies to be a policy of containment. The bordering countries to Greece they closed their borders. And so asylum seekers that thought they were going to arrive in Greece and stay a few days as they transited on were no longer able to access other European countries. They were no longer able to access border areas and cross borders into other areas where they wanted to go, where they had family. So basically it trapped asylum seekers in Greece. And this is all important because basically while the numbers reduced of asylum seekers arriving, and we didn't really hear much about large numbers of asylum seekers arriving in 2017 or 2018, those numbers reduced, but the asylum seekers had to remain, the policy that changed is that they had to remain on these islands while their cases were adjudicated. So the Greek asylum services do not generally process or adjudicate cases quickly. So people were on these islands for more than a year, which then led to severe overcrowding. So right now there's about 38,000 asylum seekers on 5 islands that have accommodation, and decent accommodation for what would be 5,000 people. So basically, it's massively overcrowded. Some islands are over capacity by 800%. So that's why you see images like this of just donated camping tents where people are living in the mud, in tents, multiple families in one tent, very limited access to latrines. Again, similarly to Venezuela, no soap, very limited soap and hand washing facilities. And so this is the situation in which we now find COVID and the prevention and response activities as it relates to COVID-19 are being conducted in situations like this. Macy, if you can switch to the next slide. So this is one of the reception and identification centers. It's on the island of Chios. So we hear a lot about Lesbos, but there's 4 other islands that host refugees and asylum seekers. And again, all of them are massively overcrowded. So as of March 1st, the Greek Asylum Services stopped receiving asylum applications. And this was not because of COVID-19. This was actually because of political issues between Turkey and the EU. And I can get into that later. But the Asylum Services stopped accepting asylum applications starting on March 1st. Mid-March, the Greek Asylum Services stopped operating altogether because of COVID-19. Also to prevent and respond to COVID-19 and make sure that COVID-19 doesn't enter the camps, which we don't have any confirmed cases yet. The Greek government locked down the camps. One thing that's important to note is that the Aegean Islands have camps that are really, again, in terrible conditions. People are living in terrible conditions. They don't have access to even good food. The food that they receive food rations and food distributions, but those distributions, they wait in line for hours and hours, and the food they get is often expired and unedible. So people also have nutrition problems and also have come and arrived to Greece with various medical problems. So that's the situation in which we are, that already pre-existed before the COVID-19 pandemic. And so myself, through my work at Refugees International and also plenty of other human rights and advocacy organizations, have really been calling on the Greek government to move people from these camps, to move them onto the mainland. But what complicates the matter is that even though asylum seeker camps on the mainland are in much better condition, that's actually where we've seen COVID-19 cases, both 2 camps and a hotel where asylum seekers are hosted have confirmed cases, and those cases have spread rapidly. So those places are obviously on lockdown, but so are the asylum seeker camps on the islands. If you can change the slide, Macy, that would be great. So this is a Syrian family, and just to highlight, there's there's families. In 2015, many people that arrived were single men, in particular going to, again, Northern European countries to kind of be the first ones of the family to access Europe. But now we have families, we have huge numbers of children that are out of school, children that are living in really unsanitary conditions. So this is all important as we think about how to prevent and respond to COVID-19, which again, is something that already before the pandemic, there was a lack of access to information, there was a lack of access to healthcare, and really the key thing, and as Marcia highlighted, the access to healthcare and the access to healthcare supplies is crucial. And really, asylum seekers, because of some policies of the Greek government, don't have access to healthcare. So for as many prevention activities and lockdowns and activities like that both UNHCR and the Greek government and certain NGOs are initiating, the lack of access to standard public healthcare is still a huge issue for asylum seekers. And so, I've spoken to many people that are working on the ground still, and they're talking about getting buckets to the camps and getting soap and donating materials. but it's still a real challenge. And what the biggest challenge I think will be, and what I'm hearing, is that while asylum seekers in these camps are taking these measures relatively seriously and trying to understand what they need to do, the keeping up the momentum of this is going to be a real challenge. And healthcare workers are really trying to prepare for what they think will be an outbreak within, a month or two, or even come the fall. And so I think it's really important to just acknowledge that, asylum seekers really shouldn't be in those conditions. They shouldn't have been before the pandemic, and they certainly shouldn't be now. And, in the past, Greek citizens and the Greek government were kind of able to put asylum seekers in certain places on certain far-flung islands and kind of keep them out of sight. But now, obviously, with this pandemic, it's in the best interest of Greeks as well as everyone, really. It's certainly of asylum seekers to take these measures seriously, but also to protect asylum seekers and give them the healthcare that they need. So the last kind of update I will give you is that as of yesterday, the Greek Asylum Services started resuming operations again. So many of the operations and case work that they're doing is online, but some of it is in person and doing some interviews. And then the lockdown for these camps has been extended to May 21st. So we'll see how much longer that goes and if it's extended again. And then finally, what's really alarming is that since the COVID-19 pandemic, the numbers of arrivals to the islands has drastically reduced yet again. And there were some weeks where 0 people arrived. However, now, just in the last month, 70 people arrived, and of those, 4 of them have been tested positive for COVID-19. So they're being separately quarantined, but the point is that, there need to be actions taken really urgently to both prepare for what will likely be outbreaks in the camps, but also to really improve the conditions anyway, even despite COVID-19 and the pandemic. So I'll just leave it at that. There were a couple more pictures, but you can check out those in other places that I can let you know about. But basically just the point being, and the point of these photos is just to show kind of the overcrowded conditions and the fact that most people are living in tents outside of the reception and identification centers. And even the reception and identification centers, which have these kind of prefabricated trailers, are stuffed full of multiple families. The social distancing is really impossible. And those are just some of the things that I saw in my research, and certainly are concerns that we have both in Greece, but also as an organization, as Refugees International, we have some of these concerns in places all over the world, which I'm sure we're going to talk about, and certainly the next panelist will address.
Okay, thanks so much, Devin. So now we're going to turn to Chase, who's going to sort of give a broader global overview of some of the challenges he's facing in his work with the World Food Program and sort of global food supply chains. So I'll turn it over to you, Chase.
Great, thanks, Kelsey. Appreciate the introduction and appreciate the Baker Institute for hosting us today. I mean, I think it's a really important conversation. I know from listening to the other panelists here, I've already learned quite a bit in the course of the conversation. And I think that you're going to see some parallels to what I talk about and what you've heard from Marcia and Devin. But like Kelsey mentioned, we're going to zoom out just a little bit here, and I want to talk about the broader problem of hunger right now around the world and how COVID-19 is really making that situation much, much worse. I think we're all living in a fascinating time right now, especially when it comes to our food systems, right? So for Americans, we're now walking into supermarkets in certain cases, many of us for the first times in our entire lives, and seeing empty shelves. There's stories of farmers who are plowing their crops under and into fields right now. You're seeing headlines from the New York Times and other outlets about meat plant workers who are falling ill and production going offline. You're paying more for bacon right now and for pork and all of these things. And these are new experiences for a lot of us here in the United States, but they're hardly new for folks internationally and the types of people that the World Food Program are working with day in and day out. So I work for the World Food Program USA. We are a nonprofit organization that's based out of Washington, D.C., and we support the mission of the UN World Food Program here in the American market. So sometimes that's private sector fundraising. Other times that's working with corporations who want to get interested or involved in the WFP mission, and also working with the US government. What you need to know about the US government and the World Food Program is that the US Congress provides about 30 or 40% of WFP's budget in any given year. And so the generosity of Americans individually and at the government levels couldn't be higher. And to be quite honest with you, it's never been more needed. You're seeing headlines right now, then you're seeing stories about global hunger crisis on a scale that we haven't seen since the Second World War, if ever before. The executive director of our organization of the World Food Program, former governor of South Carolina, David Beasley, has been sounding the alarm over the last couple of weeks and making his way from news outlet to news outlet. And when he's on those shows, he's talking about potential for famine of biblical proportion. And he's really not exaggerating the potential worst case scenario out of all of that. That's entirely possible. I mean, what's been very clear over the last couple of weeks, and we've been warning of this for several months, is that this global health crisis is slowly converting into a global food security crisis, and will continue to do that over the next few months and year. So I don't think that there's any organization around the world that has a closer eye on this problem right now and better visibility than the World Food Program. Last year, the organization was already reaching 97 million people across 80 different countries with the sort of life-saving food assistance that you often see from us. WFP, normally in a conversation like this, I would ask for folks to raise their hand if they heard of the organization. And for me, this is always, I think WFP is very much one of the world's best kept secrets. The footprint is very large, 17,000 employees, 5,000 trucks, 100 aircraft, 20 ships on the high seas. In many ways, WFP is this last line of defense between hungry people and starvation. And so we're really seeing, I think, some of these issues very closely, especially as it relates to COVID-19 and its impact on hungry people. I think, at the beginning of this, it's worth getting some numbers out of the way, right? At the beginning of the year, we actually just had a report about 3 weeks ago that came out with updated hunger numbers, or the number of people who were suffering from acute hunger around the world. And these are people who are kind of staring starvation in the face. It's not just that they're not getting enough to eat, that they're at very severe risk of death if they don't have intervention of some sort. And at the beginning of this year, at the end of 2019, we had about 135 million people in 55 countries that met that criteria. So 135 million. And that was already up about 70% from 2016. So the hunger trends were very much moving in the wrong direction prior to the onset of COVID-19. And they were really being driven and rising for a couple different reasons. One, we had this tremendous rise in man-made conflict around the world. And the other was this increase in the frequency and magnitude of climate-related extreme events. Things like tsunamis, things like hurricanes, extreme droughts and flooding situations. All of these things were putting pressure on organizations like the World Food Program already. Now, because of COVID-19, we are expecting that number, 135 million, to almost double to 265 million by the end of the year. So we are looking at 250 million people around the planet who are facing starvation without intervention. So this is it's really critical. It's an unprecedented time period. When the executive director goes around and he's talking about famine of biblical proportion, famine is not a word that humanitarian workers use lightly. And so folks are really scared about this, and with reason. Right now, COVID-19 remains this disease of the global north, of rich countries in North America and Europe, but that is inevitably changing, right? 75% of cases now are in the global north, but Africa has cases in just about every country now. The fastest growing caseloads are certainly on sub-Saharan Africa and other low-income countries. I was just looking this morning at our data from WFP. We monitor the caseload increases day in and day out. Last night, overnight, we saw a 1% increase in caseload in high-income countries and a 7% increase in low-income countries. So this is very much a looming crisis in the places that WFP is working in. Now, remember, all of these places in sub-Saharan Africa and low-income countries, as you've seen in some of the previous panelists and presentations, these are places with very limited healthcare infrastructure and services. These are places that have high levels of pervasive poverty, very limited social safety nets to be able to lift people out of poverty or prevent them from falling into poverty. And these are also places where you had the highest levels of undernourishment and malnutrition in the entire world. I mean, even before COVID-19, sub-Saharan Africa was a place where 1 in 4 and 1 in 5 people were not getting enough food to eat. And the bottom line is we know that just about every single one of these major disease outbreaks, whether it was Ebola, whether it was SARS or H1N1, nutrition plays such a big role in your ability to fight off these diseases. So I'm going to answer just 2 quick questions here, and then we'll leave some of the rest of the content, I think, for some Q&A. But the real question here is, why is the number of people going to increase that are facing acute hunger or starvation because of COVID-19? And it really comes down to 2 factors, right? One is that this sudden loss of income and unemployment for people who are already living hand in mouth is going to put people, especially living in urban areas and in some middle income countries, it's going to push them into hunger like they've never seen before and that we wouldn't have otherwise expected. The second is that there have been some local supply chain breaks in the food supply. Now, I want to break a couple myths about food supply next, but those 2 factors, the kind of unemployment, loss of income, and the breakdown in local supply chains is what's really driving these hunger figures up. The countries around the world that we're really worried about right now are food import dependent countries. So these are places like sub-Saharan Africa, parts of South Asia. There's about 100 countries around the world that are net importers of food around the planet. Other countries, landlocked countries, these are the sort of Zimbabwe's of the world, the Central African Republic, countries that are reliant on oil exportation, places like Nigeria, Angola, Chad. These are countries where people are losing foreign currency, local currencies are falling in value relative to the dollar, and importing food has become very difficult into those places. And then bottom line, I mean, COVID-19 is a case of stacking crises on top of one another. So places that we're really concerned about are places with existing conflict situations. Your Syrias of the world, the Yemens, the Sudan and South Sudan, Burkina Faso, all of these places are very high risk. So let me just touch on 2 other points, and then I want to move us over to Q&A. But on the supply issue, right now, quite frankly, global food supply stocks are quite good. We had really good carryover stock from last year's harvest. We had good estimates for what we expect to come here in the 2020 harvest season. The trouble is we still need to move that food from where it is to where it really needs to be. And there's a tremendous difference between global food prices and local market prices. And that's really, I think, is confusing people. You're seeing headlines, oh, there's plenty of food on global food stocks. And that's absolutely accurate. But WFP does a lot of local market assessments. And what we're finding is that even by the end of March, we were looking at about 15 developing countries where WFP was working, where the price of a simple basket of food had already increased by more than 10%, which is a pretty severe income increase. A couple things were happening here, right? We had food is being certainly slowed down at borders. And most cargo was still moving and continues to move. And we really are, at the end of the day, a logistics organization. And so cargo continues to move, but there is reduced staffing at borders. There's reduced staffing at airports. Some ships are waiting much longer periods of time to unload goods. All of that stuff is making it harder to move food from where it is to where it needs to be. The second is that we have a lot of farmers who are working at informal markets right now. When you think of the U.S. food system, for example, you've got commercially produced food that ends up in supermarkets where American consumers access it. Only about 20% of markets around the world, especially in low-income countries, look like that. The rest of it is produced by smallholder farmers. They work with middlemen to move food to informal open-air markets. And these are the sorts of things that are being shut down by lockdown and quarantine measures. So food just isn't making it to those poor markets. The other factor I want to talk about before I leave for Q&A is really this question of the second major driver, or potentially the largest driver of hunger, and increasing this from 135 to 265. Really, that is this economic impact and this unemployment. We actually know quite a bit about how economic downturns affect people with food insecurity. We've got really good data on that. We've got a lot of, it's happened a lot throughout history. And this is why we're really concerned. I mean, the sudden loss of income is truly devastating for people who are living hand to mouth. Yesterday, I saw some information come out from the International Labor Organization. They're suggesting that of the 2 billion people who work in the informal economy, about 1.6 billion have already lost their jobs and have no likelihood of reclaiming it in the next few months. So in a lot of these countries, you also have a huge amount of remittances that buoy the economy. I think there's probably almost $500 billion in remittances moving around from country to country. World Bank is suggesting that may fall from 15 to 20% this year. So all of these things are really impacting people's purchasing power. And ultimately, that is what's going to drive these hunger numbers up. You have to remember that most Americans, we're spending between 10 and 20% of our budgets and household incomes on food. In places where the World Food Program is working, that's closer to 60 or 70%. And so you can draw this incredibly straight line between a loss of income and starvation for so many people around the planet. And this is why the World Food Program is so concerned. Kelsey, I'm going to leave it there, but I do want to get maybe in the Q&A into some of the responses that are happening in the global level, and I can tell you a little bit more about what WFP is working on.
Great, thank you, Chase. So if everyone wants to turn their videos back on, we'll go ahead and open it up now for the Q&A. We have some questions pending. I'm just going to start with one sort of broad question. It's sort of a two-pronged question that I think could apply to all of you. So some of you, I mean, all of you in some sense mentioned the global economic crisis that's also resulted from this pandemic. And I'm wondering how you think that's going to impact humanitarian funding, both sort of in the immediate term, but also perhaps for the long term. Will organizations have to figure out how to do more with less? And maybe related to that, what can large international organizations, whether it's WFP or UNHCR, various UN agencies, what can they do to support community-based efforts at protection or ensuring food supplies or disease prevention? You know, in the case of refugees, how can large organizations like UNHCR support sort of refugee-led efforts to protect themselves? So we want to talk about sort of the financial situation, and will that have to restructure the way that large organizations do humanitarian work? So maybe we can just go in reverse order. Chase, if you want to pick up, and then we'll go back to Devin and then Marcia.
Sure. I mean, it's a very fair question. I mean, I think at this point, you've got U.S. government has already spent $3 trillion in domestic stimulus package right now to deal with COVID-19. There are very real questions about the U.S. appetite for continued funding of international programs. And that's just coming from, political reality of many, many Americans being out of work and politicians having to weigh where they want to invest their dollars. But I will say this, I mean, the U.S. government, I mentioned at the outset, is incredibly generous in many ways to the World Food Program and other international organizations. Typically the single largest donor to our organization, always the single largest donor to our organization, and the single largest donor to many others. So there is a legacy of leadership from the U.S. government on this front in particular that I think will help to buoy support for these organizations. I mean, I think that this idea between investing domestically and investing internationally is a bit of a false choice. I think most folks up on Capitol Hill know that if we don't invest in programs internationally right now, and we don't invest in the World Food Program or other organizations who are working at the front lines of the humanitarian response, that COVID-19 will end up on American shores again. But it's going to bring with it social and economic unrest in things that we're not really prepared or want to deal with right now. So costs up front, the costs of prevention are far less than what we would spend if we have to intervene later in this crisis. So maybe I'll leave it at that and let others jump in.
Thanks. Yeah, Kelsey, I'll take the next piece of this and just kind of reiterate what Chase said, and that is that certainly, decision makers in the U.S. know and understand that the investment overseas has real important impact and is important for us as well. I think that argument is going to have to continue to be made and has been in the past, but certainly will have to be continued. But I do think that one of the potential silver linings, and I'll say that very delicately, of this pandemic is that even right now, humanitarians and researchers and human rights organizations are having to rely on local partners and local, in my case, the things I work on, people that are displaced, IDP leaders and refugee leaders and asylum seeker leaders and organizations and community members, they're having to rely on them more than they ever have. And we've always talked about that in the humanitarian community as something that's important, is empowering and elevating refugee-led initiatives, but that's not always done very well. This is a situation in which we're forced to do that, and I think that that's a real potential positive, certainly if we can sustain that as the years go on. Because certainly, I mean, there's a lot of humanitarians, for example, that aren't traveling as well and aren't able to travel, and they're working on reports and issues and technical expertise from their home countries and from their computers the way we are right now. Similarly with my organization, you know, one of the biggest value adds of my organization is the fact that we go to places and see things firsthand. Well, we will continue to do that and do that as soon as possible. But in the meantime, we're really relying on the contacts and partners and refugee community leaders that we've already met and getting the information from them. And so I think that that's a potential that's happening now, and it'll continue to have to happen for some time to come, and hopefully will be a precedent that we are setting now that will continue into the future, because certainly, you know, that's important. The other thing I want to mention really quick is I think that the other issue is that with limited funding will have to be prioritization in different ways. And I will just say that as the Women and Girls Advocate at Refugees International, one of the things that I'm concerned about and we're concerned about is, even during the crisis and during this pandemic, is diverting resources away from some consistent interventions and protection, you know, interventions and activities that need to be continued, especially for women and girls: maternal health care, reproductive and sexual health services, these things that are not stopping because of the pandemic. The needs are not stopping, but certainly, you know, COVID-19 has everyone's attention. So that is something we're concerned about, we're seeing, and has to be dealt with by big international organizations and dealt with in a pretty strategic way.
Well, I would just follow up really briefly on what Devin said. Because I'm not in the aid world, I'm in the journalism realm, but I often use aid organizations to help me to get access to the people and the stories that really are so important for those regions. And usually they are not the large organizations. I probably will first reach out to a large organization, and then they will sort of, the domino effect, lead me to the local sort of grassroots organization that's really on the ground. I mean, in the case of, say, Yemen, I could get to places that, first of all, a lot of the major organizations couldn't get on the ground because of the safety issues. But if they were on the ground, they maybe couldn't leave their compound. And so I was seeing things that some of my contacts weren't able to see, but I was seeing them because I was going along with their local counterpart. And so I think really propping up those local grassroots organizations is imperative. In the case of Venezuela, these large organizations can't get in, they can't get access. So they're having to very surreptitiously, or maybe not surreptitiously, but in a creative way, you know, support these organizations. And so I think that this is a very interesting time, because for me, in the places that I go, things have not really changed. It's always been the locals. But I think now you're seeing it on such a larger level because of COVID, and maybe this is a lesson we can learn, per what Devin was saying.
Great, thanks, Marcia. I'll actually just follow up with you on Venezuela. We've had a few questions come in about your reporting and about this topic. So one attendee wanted to know, in the video clip that you showed from your reporting, at the end of the film reel, a doctor said that they are killing us, in translation. So I think maybe this question speaks to, you know, who is the they, and maybe if you could just speak a bit more about sort of the political situation in Venezuela and how that relates to the humanitarian situation that has resulted. And if you want to also answer it, another individual had a question about the quarantine centers. If you know much about sort of what is the condition there, and what are the processes then for people who end up in quarantine centers to move them back into the country. So it's two different questions there, but if you want to take a stab at either one.
So with regard to the first question, we had to cut our piece down by about half. So I lost a little bit of the back and forth with Dr. Colmenares. But I mean, you have to understand where she's coming from. She is very anti the regime of President Nicolas Maduro, as most of the doctors that I spoke with are, just because of the crumbling healthcare sector. But she most definitely blames the government of Maduro, and she, at great risk to herself, took me inside the hospital with little small cameras and hidden cameras. I had a pair of glasses with a camera. There were armed groups called colectivos that they're sort of supported by the government, but are not official government military, but they're paramilitaries, and they kind of monitor the hospitals. So she feels like, I have nothing to lose. And in fact, she said that, I have nothing to lose. It was a huge risk, but I have nothing to lose. I have to do what I can do to bring down this government and make a change. So that's the they that she is talking about. She feels that because it's a state-run healthcare system and it's been run into the ground by this government, that's who's to blame. In terms of the second question, the quarantine I think I mentioned this earlier, there's not that much information about what's happening to the people that are being quarantined. They're being held there for 2 weeks or maybe longer. In these quarantine centers, and they're being tested, but again, the accuracy of the tests I wouldn't put any real value on them. And what I understand is that the conditions in which they're being held, quarantined, is very, very poor. The food situation is very desperate. The conditions are desperate. The hygiene is desperate. And also there's a lot of fear because these people that left, that fled the country in search of a better life, are seen by some who still support the government as traitors to the state. So there is fear of retribution by some of these people that what they have done to protect their lives and their families' lives could come back to them now that they've had to come home because they either couldn't make it in the host country or the host country kicked them out.
Okay, thanks, Marcia. I'm going to switch now to a question for Devin. Whoops, it just scrolled down. But how, if at all, are COVID-related restrictions being implemented in refugee camps or asylum seeker camps in Greece? And then I'm going to tag on a question to that. What would you say has been the EU's response, so not just the Greek government's response, but the EU's response to the situation? Have they supported any precautions that Greece is taking? I know at the beginning of the outbreak of the pandemic, there was some sort of political talk about maybe the EU should be resettling people to other countries. Has that been an ongoing discussion, and do you think that's at all realistic?
Sure, thanks. Well, some of the precautions and measures that they're taking in the island refugee camps are both having a lockdown. So the lockdown, it depends on each island. Each island's reception identification center is run by a different government official, and they really have some control over how they operate and manage their camp. Some of the camps have restrictions such as only one person from the family can leave at a time. So while it's on a lockdown, people do leave to go buy food, for example, because as I mentioned, the food situation within the camps is so limited and so problematic and just not enough. So they can go to buy food, buy medicine. Prior to COVID-19, actually, the camps themselves were places where people were, but they had freedom of movement on the island that they were on. So so while they couldn't leave the islands, there was a containment policy, which I described as being the reason why there's such overcrowding and such problematic conditions. While there's a containment policy, people could leave the camp itself and go into the main towns and buy things and do what they need to do. That has been restricted to, in some places, one family member at a time or 100 people per hour. So they have some of those restrictions. Again, they're trying to do public information campaigns, which have been semi-successful. And I think they need more of that. So those are some of the main restrictions, is really just the lockdown, I would say, and some of the restrictions. Also, so much of what was being done in the asylum seeker camps, so many of the services were actually being provided by NGOs, and really local NGOs. And when I say local, I mean local European NGOs. And so NGOs that we haven't necessarily, they aren't the big international NGOs. They are NGOs that have been created and started within the last 5 years to respond to this situation and to really fill the gaps that the Greek government is not doing. They're not doing their jobs on certain measures and certain providing certain services. So NGOs are doing that. A lot of those people, again, like I said, are back in their home countries, or they have limited access to the camp itself. So very limited numbers of humanitarians and NGO workers are allowed in the camps. And also there's restrictions as to how many people can come out and when they come out. In terms of the EU, so the EU, it's interesting, in the beginning of March, when there was a political situation between Turkey and Greece where the Turkish government basically said, we're no longer going to uphold our part of the EU-Turkey deal, and refugees from Turkey can go into Europe. We're not going to restrict them anymore. That created a huge issue, as you might remember from the news, beginning really first week of March. In that case, the EU supported Greece. They supported Greece on closing the borders, being really restrictive, shutting down, asylum applications and the ability to accept asylum applications. And they gave €700 million to Greece specifically for border management. 350 million of that specifically for kind of border restrictions, and then the other 350 million for other things. That position has since changed. So with COVID-19, what's been interesting to see is that the European governments and leaders of the EU have come out and said, these conditions are not okay for asylum seekers, and they're not okay for asylum seekers given the risks to COVID-19. So EU leaders have called on the Greek government to relocate asylum seekers, to relocate them to hotels. There's hotels on these islands, for example, they're all closed. They're all closed to tourists. So, they're trying to come up with creative solutions to move, especially the most vulnerable, the immunocompromised, the elderly, which there's a lot of. I mean, there are a lot of elderly people on these islands that have a lot of issues and a lot of medical concerns. So some of those transfers are happening, but in very small numbers. And then finally, I guess I'll just end it on the piece of good news, and that is that at the time that I left Greece in December, but also early this year, there were more than 5,000 unaccompanied minors. 75% of those were living in unsecure accommodations, so with random strangers on the street, in tents, just not in situations that were safe at all. And several European countries have stepped up to relocate those asylum seekers and to have some of those unaccompanied minors go through the asylum process in their country in safer conditions, in accommodation centers that have all the resources they need. So Germany, Luxembourg, a few others. Portugal has just agreed to accept 500 unaccompanied minors and relocate them. So some of this relocation resettlement process is happening and will happen. Even with travel restrictions, some of these people are moving, some of these unaccompanied minors. The majority of them will move once some travel restrictions are lifted, but that is happening, and that is a good step and a good sign. And really, those children are some of the most vulnerable asylum seekers, and were at risk of trafficking and sexual abuse, and they were getting into violent clashes between each other. So there's a lot of issues going on that hopefully will be ameliorated because some of that relocation.
Okay, thanks, Devin. We just have time for one more question, I'd say. So I'm going to direct this to Chase. There's a few different questions actually for you from our audience. Someone wants to know more about how the World Food Program is funded, if you want to briefly address that. Someone else wants to sort of know what's the way forward for dealing with issues of world hunger. I'm going to ask a pointed question in case that's easier to answer in the remaining time. I know that you work sort of on, you're with WFP USA. So what would you say are some policy recommendations for the US government in terms of what it could maybe do to mitigate some of the fallout for global food chains?
Yeah, well, the two questions are definitely related to one another. WFP receives a majority of its funding from governments around the world. And like I said, the United States government is extraordinarily generous in that regard. Last year, the organization received a little over $3 billion from the US government. And so that's an incredible amount of money. The thing is that U.S. has this really strong relationship with the World Food Program in many ways. The idea and concept of a World Food Program kind of stems back to the Eisenhower administration. It was shepherded by the Kennedy administration. Senator George McGovern from South Carolina really brought it into life. So there's a lot of deep connections and a legacy of support to this organization by the American people. So this doesn't mean that governments are the only major funders, the only important funders of the World Food Program. We always have major funding deficits year in and year out. Last year, WFP was a $12 billion organization. That was operational needs. We received maybe a little over $8 billion in support. So increasingly, the private sector, foundations, corporations, a lot of people are starting to step up because there is an important role to play there, and those needs are very genuine. In terms of the U.S. government, I mean, the last legislative package that you saw passed last Friday by the House was a $3 trillion package for COVID-19 response. There was no funding for international programs at all in that bill. Now, across the $3 trillion that's already been made available and signed into law by the president from the U.S. government, about $2 billion in that $3 trillion, so that's less than 1/10 was directed towards international funding. Support for USAID, support for our State Department, various embassies, a variety of programmatic interventions. So quite frankly, what's needed next is for the Senate to step up in their compromise bill with the House and provide some funding for foreign assistance and humanitarian response in this supplement. It's not enough just to be as generous to the humanitarian community as we were last year. We have to step up because there are brand new COVID-19 related needs that I've just outlined throughout the course of this conversation. So, I mean, the best thing that we can be doing is looking to this next stimulus package, leaning heavily on our friends on Capitol Hill. And I encourage folks to get involved in that, to reach out to their members, to say, hey, this foreign affairs stuff matters a lot. We can be funding some of this. To be honest, we've had tremendous growth and improvements in the way that we've tackled global food security issues in the U.S. over the last 10 years. I want that progression to continue. Global Food Security Act was first passed in 2016. It was reauthorized in 2018. All of this makes critical funding available for humanitarian programs and long-term agricultural development. Many of the policies are already in place. The only other place that I think we can be doing quite a bit more now is on social safety nets. In the United States, when we ran into trouble here at home, we scaled up our SNAP and WIC programs, our food stamp programs. If you go to low-income countries around the world, less than 20% of people have access to any sort of social safety net or protection, let alone food-based social protections. So USAID, USDA, I think can be leaning into those programs a little bit more. WFP is certainly doing its part in this regard. We are trying to the extent that we can to be moving our interventions through existing social safety net programs. So you're not creating parallel process, but you're supporting existing mechanisms for food delivery and food assistance in countries. So maybe I'll leave it there.
Great. Thanks so much. Thank you to all of you for lending your expertise on this timely and important topic. And thank you to the audience for tuning in and asking great questions. A recording of this webinar will be available on the Baker Institute website in case you have any colleagues who weren't able to attend today but still want to listen in. And please join us again for other future webinars. So thanks so much, everybody.
Thank you.
Thanks, everyone.
Thanks, Kelsey.